Every part of medicine has the highs, the lows, and you have to be able to tolerate the best of days and the worst of days. There were times where if one of my classmates was on vacation, I was working every other day, 36-hour shifts and working 120 hours a week. One of the coolest things that has happened a few times is I've had some students either writing essays for college or for medical school about the impact that our relationship has had on them. That's something I'm so proud of. I have the best job in the world, and it's really what drives me. It makes the work worth it.
Hello, and welcome to the Career Journey podcast, No Wrong Choices. Today's episode features the highly respected physician, Dr. Beth Rackow of the Columbia University Medical Center in New York City. I'm Larry Samuels.
I'm Tushar Saxena.
And I'm Larry Shea.
We'll be your hosts for what will undoubtedly be a fascinating conversation. Before Beth steps in, please be sure to support the show by liking, following, and subscribing to it wherever you get your podcasts. Now let's get started. Now joining No Wrong Choices is the highly distinguished OBGYN Dr. Beth Rackow.
He has to say this.
Dr. Rackow works for the Columbia University Medical Center here in New York and is consistently recognized as one of the top doctors in her field by prestigious organizations such as Castle Connolly and New York Magazine. She's also an associate professor at Columbia University Medical School. And on top of all of those things, happens to be my wife. Dr. Rackow, thank you for joining us.
Thank you so much for having me.
Okay, Beth, so here we go. You have all these great accolades, Beth, and yet you married Larry Samuels. What is the problem with you?
Everyone has faults.
Everyone's not perfect. I guess everyone's not perfect.
You really need to answer that.
You have to answer. This is the answer portion of the program.
Well, let's just say that Larry was not intimidated by a strong, career-driven woman. And actually, that was the type of person he wanted to partner with. And can't say in my experience that those men were very easy to find. And we connected. So there.
That's a great answer. Still, you could have done better. Anyway.
It is the best thing that's happened to me. So there.
I got very lucky too. So now that awkward part of the conversation is over, let's set up the conversation. So Beth, each of our guests, we asked to just give us a bit of background in terms of who you are and what you do. So please set things up for us that way.
I was thinking about this before this interview, and the little snippets of a Twitter profile came to me. So I am a wife, a mother of both a little boy and a dog, a physician, a friend. I'm an outdoor enthusiast. I used to get to do more outdoor adventuring when I was younger. A advocate for causes that are important to me. Larry is annoyed by the fact that I'm a compulsive recycler.
Yes, I am.
What does that mean? You throw stuff out? That's it?
And I guess a reformed/former athlete.
And what do you do for a living?
So by training, I'm an obstetrician gynecologist. And after I finished my 4 years of residency, I specialized in a field called reproductive endocrinology and infertility, where we focus on hormone disorders and gynecologic disorders that can affect reproduction, and also treating women and couples and individuals with infertility. As part of my training, I also became enamored with this very niche area in OBGYN, where specialists take care of girls and adolescents who have gynecologic issues. Because when a 10 or a 12-year-old girl has a gynecologic issue and calls a regular OBGYN to be seen, most of the time they're not comfortable seeing someone that young. And it really is a special level of care to provide children and adolescents who have gynecologic issues. So that became part of my niche practice between the endocrinology knowledge and surgical knowledge. And there's a number of people in the country who also have the same skill set that I do. So I spend my days in a few different places. And every morning I wake up and I have to remember which office I'm going to and what day it is. Otherwise, I might get very confused. I see gynecologic surgery patients, which include females and individuals from birth on up who have gynecologic disorders and surgical issues. And I provide surgical services for those individuals who need different types of gynecologic surgery, always with the mindset of protecting their future reproductive potential when possible. Then I also spend time at the Columbia University Fertility Center, where I provide the full scope of infertility care for individuals and couples who are trying to conceive. That makes up my entire week in terms of some office-based days seeing patients, some procedural days, and some surgical days as well.
So let's go back into the time machine. Go back to the beginning. Fellow nutmegger, just from doing my research, Connecticut is your home where you grew up. What was it like growing up in Connecticut? What was your family like? And what was the dream originally?
Well, I grew up with a family of 4, 2 parents, a younger sister, and then several dogs along the way. And we grew up in just east of Hartford, in a town called Manchester, Connecticut, that was sort of a low-key town, a town that emphasized education, sports programs, and was a great place to grow up. We made tons of friends in the public school system. One of the highlights of my youth was playing on a competitive girls soccer team that won the state championship 4 times.
Wow.
And that was a formative part of my childhood. It was a huge part of my identity. And I think a huge part of what started to make me who I am today was playing competitive sports on a team.
So did you envision yourself as a younger girl being a professional athlete or going into another field where obviously you would try and feel those competitive juices?
I think I knew the competitive drive in me was going to lead me elsewhere because I think I knew my physical limitations at 5 foot 1 inch. That the number of true sporting options were definitely limited. I was never that great at any sport. I just loved playing sports and I loved being part of a team.
Did that competitiveness carry over to your academics?
Good question. I think it definitely did. I mean, I was a bookworm as a child, always really curious, and loved school. And school came fairly easy and naturally to me for a long time. I think I was competitive, yes, with those around me, but I think I was most competitive with myself. And I think I had this internal drive to do well and to succeed. And that was definitely something that was in athletics as well as in academics.
What was your favorite subject?
I like the sciences. I definitely liked biology, but as we talk about my story today, I'm sometimes a little more scattered than that. So I also liked my English classes and I also thought history was cool. So yes, I would say science was one of my favorite classes and biology definitely was inspiring, but I liked a lot of other things too.
Was this self-motivation or family-driven? What was the genesis of that?
I think there's a good amount of self-motivation, but I would say I also had parents who were strongly encouraging of my ambitions and were also pushing me in a good way. Like my mother used to joke that she kept me so busy with after-school activities, I didn't have time to get in trouble. My parents were supportive and appropriately pushing me to work hard and excel.
So in high school, who was Beth Rackow? So you're playing sports, you're doing well in class. When does this person that you've become really start to emerge? Are you a leader? Who is Beth Rackow during those high school years?
In high school, some parts of me blossomed. I think that's when I started to have more leadership opportunities. In fact, I was class president as a freshman and again as a senior. And I think I took on a lot of leadership roles on teams. I don't think I was a team captain, but I was often someone other players still looked up to. And I was always a hard worker. I also participated in other extracurriculars. I wasn't just an athlete, but I was engaged in other community service projects and other things that I also thought were important.
Yeah. So, I mean, this starts to make a lot of sense then, right? You have competitive edge with sports. Your favorite classes are science, biology, and you want to help people and give back. I mean, I'm starting to see doctor.
It's pretty clear.
Yeah. Is that how it worked? And like, at what age are you seeing that goal and saying, this is going to be something I'm going to do for the rest of my life?
Well, when I was a little girl, my father would come home, and every single night he would call the patients that he had done procedures on that day. He was an endodontist, so he would be doing a lot of office surgical procedures. And I would just love to just crawl into the room where he was and listen to him talk to his patients in his like doctor voice, listen to him call prescriptions into the pharmacist and use all this jargon. I was so enamored by what he did.
What's a doctor voice, by the way? Give me a doctor voice.
It just became had this like cool, calm demeanor and very matter of fact. It was a different tone than he would take with me and my sister, et cetera. So that was a very formative sort of part of what encouraged me just to think that what my dad did was so cool. And growing up, my parents' closest friends, one was an internist, one was a dermatologist, one veterinarian. And so there was lots of medicine talk around the table when we'd all get together. And I just thought that how they gave back to people and helped people and animals was just the most remarkable career journey. And I sort of never looked back. It was always in the back of my head that being a physician was something that I wanted to do. But I came from a line of dentists. So my dad's dad, my paternal grandfather, who I never knew, was also a dentist. So I was on track to be the first MD in the family, but still following that family line of medicine and dentistry.
It seems a good time to ask, so let's get it out of the way. Whenever I thought about being a doctor, I was too squeamish. I was like, not happening, blood, guts, nope, not happening. Did you ever have any of those thoughts, or wasn't even a concern?
So interestingly, I learned over time that if I was the doer, like when I'm doing things, it doesn't really gross me out or freak me out. However, there was a time when I was on an internship in college with an anesthesiologist, and I was watching him put in an IV, and oh my gosh, I started to feel lightheaded and dizzy and had to go somewhere cold and leave the room. And when people are doing stuff to me, I can't really watch.
I can't either. Same thing. And you're a doctor.
I used to think I could. I remember when I was younger, someone was taking a mole off my leg, and I was like, oh, I want to go into medicine. I can watch this. And I totally started to feel lightheaded and dizzy. I don't really watch blood draws, IVs on me.
Really? The needles freak you out?
The needles don't freak me out because I've taken tons of them and had to give myself tons of shots. But I can't watch someone do these things to me. I just look away.
Wow.
It's fine.
I gotcha.
Yeah, same.
So let's talk about the next step. Where was college?
So when it came to college, I looked far and wide. I knew I didn't want to venture too far from the Northeast. And I wanted to get the best education, the best experience, be part of the best, like the community that felt right to me. I was also a little crazy because I played a very unique sport. I played women's ice hockey, which was something I started to pick up and play.
Is there a sport you haven't played? Soccer. You play hockey, for God's sake.
So I had been a figure skater as a kid, and in high school, I had this amazing coach who coached me in soccer and groomed me to play ice hockey, and I fell in love with that sport. And so I knew if I could find a way to play it in college, that would be awesome, because I knew that there would be no hockey for me after college. Like, I had no crazy aspirations. I was limited in terms of places that were schools that I wanted to go to that had a women's college hockey program. So that was the other thing. I looked at places that didn't have college hockey, but somehow the opportunity to go to a great school and play hockey was just a double win. And I fell in love with Yale. And so that is where I ended up for college.
Yale's pretty good too, by the way.
Yeah, settled for Yale.
I had a good experience.
Talk to us about Yale in New Haven. Was it isolated? Did you leave campus? Because New Haven can be a little crazy. Just knowing the area myself, obviously the best pizza in the world, but
You can say it.
besides that,
New Haven's a little bit shady.
it's a little bit. But Yale, I know, and most college campuses, you could just stay on campus and get enough of a varied environment that it's not a big deal. But did you venture out? Were you so busy with your school that you didn't really do much extracurricular stuff? What was Yale like?
Yale is a fairly sizable college, and then there's all the graduate schools that are part of it, but they tried to make the community much smaller by having these residential colleges. So you are assigned randomly to a residential college. I think at the time there were 12 residential colleges, and I was in Trumbull College, and it was a way of taking a freshman class that was maybe, I feel like 1,200 or so, and making it had to be more like 2,000, and it was more like 200 people in your class were part of this group. And it gave you more of an identity and made a larger place feel a lot smaller and intimate. And that was important. The other thing is Yale campus, it definitely spreads out. There's a bunch of blocks that are all together, but I spent a lot of time on Science Hill and at the rink. And those were, a mile off away from campus. So you definitely didn't always feel like you were on campus. And then the other thing is, as we talked about community service before, I did a lot of community service, working at soup kitchens, teaching environmental education to kids in classrooms. So I definitely felt like I got out and got to know the community to some extent by participating in the tremendous community service offerings that were a great part of my Yale education.
What are the dynamics for the students? How competitive is the environment? And is there an underlying theme of competitiveness at that level?
The joke often was at Yale that the hardest thing was to get in. And then once you got in, you could be as intense as you wanted to, but you didn't have to be. There was a wide variety of people who were much more driven, cutthroat, took the toughest classes, had to be top of the class, and lots of people who just lived life as a Yale student and did what they had to do. But a huge part of the experience was the socializing. A huge part was the amazing celebrities, international figures, you name it, who would come to campus to lecture, who you had access to. There's so much about the experience that didn't just happen in the classroom.
So I know you had the passion for the outdoor stuff as well. You're studying the environment. Was it close in terms of choosing environmental work for the rest of your life, or being a doctor, which you were so enamored with when you were younger? And were you doing both at the same time? Was there a switch that happened? Tell me about the actual decision of, all right, I'm going to then put the environmental stuff over here and focus on this.
I always told people that I had two passions, that one was the environment and one was medicine, and that I also knew that a career in medicine was a much more straightforward route. If I wanted to do environmental stuff, I might have done environmental law. That was a brief thought. Interestingly, my environmental interest and passion led me to work for the National Park Service for 2 summers. I was a park ranger intern at Yosemite National Park, full-on government employee at Acadia National Park. I got these fabulous experiences, and I would be out there teaching groups of people, leading them on hikes, teach them all about the park, what was unique about it. And that, I think, helped me with public speaking. I learned a ton. I would go hiking on my days off. It was 2 of the best summer experiences possible as I was submitting my medical school applications. So I knew that that was part of me that was going to get tucked away a little bit once medicine became my career path. Interestingly, on the interview trail for medical school, there were people who asked me why I wasn't going to get a master's in environmental science instead of medicine. And there were people I had to convince why you can have more than one passion in life. And then there were people on the interview trail who thought that it was great that I had more than one passion. And there were other things that made me interesting. So, and there was some convincing that needed to happen.
Yeah, sounds like it. Little inside the podcast here. Larry Samuel sends us notes on his lovely wife. And last night I'm going through the notes and he's like, I think she worked at Yellowstone. Or maybe Yosemite.
Alas.
Just like, I don't know. I'm like, I'm going to quiz you. I'm going to quiz you tomorrow during the podcast because you need to know. I love Acadia. Say the name of the town that Acadia National
Our
Park
harbor.
is in for me. I was wondering if it was going to be Bahaba. Give me the main
Yeah.
version. Cadillac Mountain, a wonderful, wonderful place. But so it was close. There was a lot of convincing that needed to be done for you to actually take the leap and be a doctor, correct?
Well, I knew I wanted that path. I had to convince others that I was dedicated to that path. Just
meaning
because
professors, family.
when I was out interviewing for medical school, my
Right.
personal statement probably talked about another experience I'd had. My list of jobs before, et cetera, were all environmental based. And just because I hadn't been in a laboratory doing basic science and writing papers on that, my path wasn't the typical medical student trajectory, even though in my heart, that was always what I wanted to end up doing.
I'm curious about your learning process because to be a doctor, obviously vast amount of knowledge needs to be gained. People sometimes visualize something, photographic memory, repetition. Were you challenged at Yale? What type of a learner were you? Did you just have to grind it out or did it come easy?
I would say in college, some classes were easier than others. The sciences were tough. They definitely were. I graduated, I don't even remember what my GPA was. It was fine, but it wasn't anything exceptional. But in medical school, some of it came easy, but I also worked really hard. I took copious notes. I studied a lot. I was poring over the information plenty to get it to sink in. I recognize that some topics came easier than others, but I put in the time.
How many medical schools did you apply to?
I don't remember. 10, 15.
That
Oh,
many?
wow.
10 or 15. Wow.
What is that process? Is it a unique application for everyone where you're spending months putting the stuff together?
I really don't remember. I believe there might have been a common application, and then every school had extra information that they would send you, extra essays wanting extra information. And then you had to take a test, this test called the MCATs, this medical test, hours and hours, where the score mattered, and also letters of recommendation. So there was a lot that went into your application.
Do you remember how many schools you got into?
1.
Really?
Yes,
15 applications you got into UConn.
correct. And I got into UConn off the wait list. So I didn't get in on,
Really?
yes. I mean, it is interesting, and it's something I definitely share with students, also people who I know of who are trying to get into medical school and having a hard time. I don't feel that the medical school application process, at least at that time, and this is what, 1996, was geared to let in everyone who was going to excel in the field. It was very focused on test scores. It was very focused on research and places where I didn't shine. And at UConn, the director of admissions thought it was the coolest thing that I was park ranger. And when I graduated towards the top of my class and from medical school, I remember saying to him, me and my 3 anatomy lab partners, at least 3 of us got in off the wait list and we all graduated towards the top of our class. And I was like, don't you think you should
Wow.
rethink your admissions criteria? Because 3 out of the 4 of us might not have gotten in.
I'm just so curious, what would you have done if you didn't get into that one school? Would you have, kept at it, or would you just pivoted?
But what about all those
Park ranger.
people who you take care of every single day? Where would they be?
I graduated college, and it was actually just a personally really trying time. I had not gotten into med school yet. I was on the wait list at 2 places, and I was starting the process over. Yale was still helping me as a graduate. I had a new advisor. I was out of college, living at home, and starting the application process again. And in that moment, all of a sudden, I got this call July 5th, and they said, "You want to come to UConn?" I was like, "Can I take a year off and then come?" And they were like, "Now or never."
What were the
car.
emotions during that period of time? I mean, you must have been so stressed out.
It
I mean,
was-
like, what were those emotions?
Right, because you graduate college and everyone's like, "What's next?" And I'm like, don't really know yet, but I'm going to work. I am committed to seeing my dream happen.
Amazing. So going to med school very quickly, I just want to get a feel for the day-to-day. What are the demands on a medical school student? Are you putting in 12, 14-hour days? Are you constantly studying? Are you constantly in the lab? What are the rigors of medical school in general?
The first 2 years are mostly classroom based, where at my medical school, we learned all the normal anatomy and physiology year one, and then we delved into the abnormal year two. And year one is the year that we did gross anatomy, where we literally dissected a cadaver all year long.
Can I interject for 1 second? Tushar, does abnormal make you think of a movie?
Abby Normal? Of course it does.
Frankenstein. Sorry, I had to get that in. Please continue.
And so those first 2 years are mostly classroom based, but we would get some experience starting to learn clinical skills in the physical exam and talking to patients, because we would some certain afternoons go off and work shadow physicians and start to get some experience. And then third and fourth years is when you're doing all your rotations and going to like pediatrics and psychiatry and internal medicine and surgery and OBGYN and getting these multi-week rotations through each field. Your classroom time, I think, if I remember correctly, was very structured. You had class 9 to 3, 9 to 4, whatever. You had labs, etc. But then you would spend your evening studying, socializing too. It was also a very social time, but you would study because you'd have tests, practical exams, etc. But when you went onto rotations, that's when life was crazy. That's when we were up at 4 and 5 in the morning at the hospital, because the medical students had a round before the residents, before the attending physicians, and the hours were just insane. No one was paying attention to how many hours we worked. And you would also take call alongside residents, et cetera. So it could be, depending on the rotation you were on, it could be really, really difficult.
So you're a triple threat in terms of your own concentrations. You're a surgeon, OBGYN, REI, I believe. How did that factor into medical school for you? At what point did you say, okay, I want to be an OB, or no, I want to be a surgeon. I want to go into this aspect of my medical career. How did that play into medical school for you?
I remember going through all my rotations and really enjoying every single one. I even liked psychiatry, which is good because I feel like I'm a part-time psychiatrist in my day job.
And your night job, too.
So
Nice.
you get all these experiences. And I began to realize that I liked continuity of care. I liked taking care of someone throughout a chunk of time in their life. I didn't like seeing a patient in the ER and then not knowing what happened when my shift was over. I didn't like being the surgeon who fixed something and then sent the patient on their way. So I realized I like continuity of care. I realized I was really inspired by women's health. And I realized that I liked the surgical aspect of medicine and that I liked fixing things. And I had some really awesome experiences with some surgeons where I was at some really small hospitals doing a surgery rotation where it was the surgeon and it was me. And I was the other body scrubbed in, and they were letting me start to learn breast biopsies, appendectomies, all this stuff, skin closures for plastic surgery operations. And I learned so much, and I fell absolutely in love with the surgical part of a career. And I realized that there's only a few specialties that allow you both continuity of care and surgery. Now, my classmates had pegged me as an OBGYN from year one, and everyone's like, you're going into OB, we know it. And I was like, come, let me experience everything else. But they were right.
As you're telling that, you're stressing me out. So I have to ask the stress question, because I couldn't imagine doing what you do and studying like that and the hours that you were keeping at that point in time. So at that point, did it stress you out? Because you sound excited about it. You sounded like the challenge was gripping and exciting and passionate about it. Whereas for me, my heart starts racing and I'm like, I can't do this. So thank goodness for people like you. But were you stressed back then? And if so, and if so now, how do you handle that stress? Was sports a part of it in college? And now you have to handle that very differently?
The way I handled the stress in medical school and residency was working hard helped me just feel better. Like I had more command of the information I needed to know. Preparation.
Yeah.
I also played on a local soccer team throughout medical school and then a separate team when I was in residency, keeping up just some athletics. I was a runner way back then. So I would run for exercise. That was very important for my mental health. And then also connections with people who weren't in medicine, because it is also so easy to just pigeonhole yourself and only talk medicine all the time. In fact, when I was in residency, I lived with my sister, who was a law student at the time. And I loved it when her friends would come over and we wouldn't talk about medicine.
So, Beth, the times when students hit the rotation portion of their medical school career, when you all have to head into the hospital, as you said, the first couple of years of med school, it's all about classroom work. Does it become more like boot camp when you officially hit the hospital and then obviously you're working hours upon hours upon hours on end? Is that really where you separate the wheat from the chaff?
Yes, I think the intensity of the rotations, absolutely. You're part of a team. Med students can only do oh so much, but you're there to help, to run errands, to take care of the most mindless of tasks, and just to soak it all in and learn. But it can be a grueling experience based on what's expected of you, the number of hours. And I will say medical school is much kinder and friendly now when I see how our medical students are treated.
The kids always have it easier now than we did back
100%.
then.
True.
How hands-on was it at that point? I mean, obviously you said you do a lot of scut work, you're following around residents, etc. But how hands-on was it?
It really depended on your team and on like your senior resident and who took you under their wing. And I think if you were interested, motivated, and worked hard, people were always willing to give you more experiences. If you were annoying, whiny, and didn't want to work that hard, of course, people weren't that invested in your education. So that's a very simplistic view, but I think you found ways to gain more skills. I didn't really know how to place an IV. And by the time I was a fourth year medical student, I was like, shoot, someone's got to teach me how to do this. So I was on my ER rotation and I made friends with a bunch of the nurses and I got them to teach me because they're the ones who are so good at it. And they would find all the people in the ER who needed IVs, who had these big veins, and they would pull me into the room and make me place IVs. And to this day, I'm actually very good at it. But you had to seek out opportunities. And so like anything in life, experiences are what you make of them.
So focusing things a little bit. We've gone through college. We've gone through medical school. If I remember correctly, you did your residency at the University of Pennsylvania in Philadelphia. So you've chosen to be an OBGYN. How do you start to focus and really begin to become the Dr. Beth Rackow that we know today? How do you make those choices, those decisions? How do you sharpen that lens?
So again, it's the breadth of experience you get on all your rotations as a resident, which are now all focused in the field that you plan to have your career in, where you spend time learning obstetrics, both in the office as well as on the labor floor. You learn gynecology, both in the office and in surgery. And you learn from all the subspecialties that are part of our field and start to realize what resonates with you. Again, I had mentors that helped sort of shape who I am and the career that I wanted. But I realized that I liked some of the younger population in OBGYN. I still liked continuity of care and I still liked surgery. I was really enamored by the field of reproductive endocrinology and infertility. And again, mentorship played a huge role in making me the person that I am today. By my second year of residency, I hadn't really thought that that was what I was going to do. I thought I was going to be a high-risk obstetrician. And that's what most people thought I was going to do, just based on what it seemed like I liked. But this was a huge right turn to a very different field, which is more based in medicine and endocrinology, but also surgery and infertility care. I was fortunate that one of the people who I'm still close with today also focused part of her practice on the care of kids and adolescents who have gynecologic issues, specifically problems, many of which aren't issues that a general obstetrician gynecologist are comfortable taking care of. And so I also knew that this was a niche field that I wanted to be part of my practice.
Before making this decision, how many babies did you deliver?
Oh my goodness.
I know the answer that I'm asking this question.
I think it's well over 1,000.
I couldn't
after
let
all
that
these
slip
years.
by.
1,000 kids you brought into this world.
Lots of, I also trained before what is now the 80-hour work week. So nowadays, residents have their work hours carefully monitored and they can only work 80 hours in a week. They can only work so many hours consecutively without a 24 hours off. As I said, kinder, gentler, definitely better. They learn so much better when they're not one eye open all the time. Working before that, there were times where if one of my classmates was on vacation, I was working every other day, 36-hour shifts and working 120 hours a week.
36
Wow.
hours.
Yeah,
my
because you'd
God.
show up in the morning, you'd work till the next evening, and you'd go home and
Yeah.
sleep, and you'd come back the next day and do it again. It was a tough way to learn. I mean, lectures were hard to keep your eyes open during. We, drank tons of coffee. There is something to be said for a sick patient coming in into the hospital, and you took care of them for 36 hours. You learned so much. And these days, there's more handoffs and shift work, but it is a better lifestyle and a better way of learning. So that was definitely a rough patch.
What do you love about the job and what do you hate about the job?
Well, what I love about my job, I love the connections that I make with patients. I love helping people, especially when some of the things I do and offer are things that either others haven't been able to fix or haven't been able to figure out. The figuring out, the problem solving, and then improving the quality of someone's life. I mean, that just is one of the coolest things. What do I not like about it? My husband will know this. I'm tortured by medical records. I'm tortured by
Right.
notes and keeping up with constant communication from patients. One of my practices, patients email us. My other practice, patients send portal messages, and it is nonstop. That I think is hard because you feel such a responsibility. I think some of it is hard to delegate to somebody else. And I think AI is coming to help with this. Larry, they're talking about it. It's very exciting, but hoping that there's going to be other ways to help write some of these notes and provide documentation that isn't me sitting on the couch catching up on notes at night.
Speaking of responsibility, how do you handle mistakes? I mean, we all make them. And
She's got malpractice insurance, you moron. Stop it.
but seriously, and it's so funny. I have so many questions related to that because we all talk about like, oh, I don't feel like myself today. I don't feel 100%. You can't have a bad day. Like your bad days, there are dire consequences. There are bad things that happen. And I was joking with these guys before. If I have a bad day, like a game doesn't get on the air on Sirius, oops, that's a bad day for me, but there are lives at stake. So how do you handle mistakes? Do you feel that pressure and that stress?
Yes, there is pressure and stress. I mean, to be a surgeon and take on that responsibility. But I think, the things that I do is I'm very detail oriented in terms of the evaluation, the testing, the counseling, all that goes into taking care of a patient. I work with amazing colleagues, and there's always people around that I can bounce ideas and things off of. I have colleagues outside of my specialty who I know I could turn to for help if I need help during a surgery, or if I need my patient to see someone else and get another opinion or have something else looked into. So I think that there's something about the community and the people who surround you that helps you through sort of the stress of the grind of the day-to-day job.
Right.
In terms of handling mistakes, I mean, I think we know that in medicine, outcomes cannot be guaranteed. And it's one of the hardest things. It's something that I talk to patients about all the time. I mean, there's days I come home and I just say like, gosh, I'm just so tired of giving bad news. And a lot of these things aren't mistakes, but they are just things that we have no control over, things we can't fix. But there have, of course, along the way been things that haven't gone the way they're supposed to. And I think acknowledging it to patients and explaining what happened and finding ways to make it right. I think being open and honest to the best that we can is important.
How do you stay current with procedures, with new practices that are out there, with new teachings that are out there? How do you stay current?
So a lot of different ways. We have continuing medical education, and I have to do X number of credits per year of either going to meetings and saying that I sat through this number of lectures, reading articles, and there's a certain number of articles I have to read every year to maintain as maintenance of certification. So there's a number of different ways, both locally within the two divisions that I work within. Like we always have either people coming to talk to us, or we have people
Right.
presenting papers and things that we're talking about in terms of current research, going to national meetings, talking to colleagues, listservs. There's so many different ways to work to stay current.
How do you prepare for surgery? Everyone has a routine or something to get your frame of mind right. Do you meditate? Do you play loud
Say,
music?
listen to
Yeah, what
Metallica.
music do you
Everyone has
listen
a
to?
different thing I think that they do. I don't know what I would do, but if I'm laying on the table, I want to make sure that my doctor
Yeah.
is focused and ready and with it. What's your
So
routine?
funny. Like, I definitely get my game face on, but there is coffee
Mhm.
in the morning. It's
Okay.
got to be
And the
there.
game face, by the way, starts the second she gets out of bed. She's focused from the very second her feet hit the floor.
Yeah, because I'm usually running late, and so I need to like get there. So there's coffee, there's putting my scrubs on, putting on my OR hat, talking to the patient, signing consent forms, and that's starting down my process of focus. I mean, the night before, I usually have reviewed the patient's chart and reviewed my plan for surgery. So I have all that information fresh in my head. And then in the operating room, I'm talking to the team who's with us today about what we're doing for each procedure. We even have a timeout procedure that's required by the institution, but we're talking about through a list of what's the case, what are our concerns, what are safety things we need to think about, unique issues for this patient that need to be on our minds, what's everyone's name and role in the room. We all make sure that we know each other. And then once we get going, we turn on music. And I like to have music in the background. And
Yeah.
my husband does not like pop music. So I have pop music in the background, and who knows what it might be. There was one year where it was a lot of Ed Sheeran, Justin Bieber. There's like anything under the sun. Anyways, but
I would not want you to be my surgeon if you're listening to Bieber. Not a chance.
it's not loud. I just need to actually not be in my head too much. And I just need to have
Right.
a little something because I can't have the room be quiet. But I also don't want to hear everyone else's side conversations.
Right. What is the timeout procedure like? And how many people are in the room
So
roughly?
usually in the room, we have an anesthesiologist, me, the surgeon. I usually have someone training with me, usually a fellow. There is a scrub tech who's handing us instruments and a circulating nurse. That's the minimum. And sometimes there's a few other duplicates of other people who are in the room. Sometimes I have a medical student or a resident with me as well. And the timeout is actually it's a very serious moment where everyone is supposed to stop what they're doing, announce that we're doing a timeout, no music on, and everyone's paying attention and not fiddling with something or still organizing or setting up. I run it. So the surgeon is supposed to talk through who the patient is, their medical record, what the procedure is. And then we talk about, do they need antibiotics? How are we preventing blood clots? What are our safety concerns? Do we need blood products ordered? All these different things that we go through and make sure that everyone is protected with the appropriate personal protective equipment. Everyone has eye protection on, and that everyone's in agreement that we've gone through everything we need to go through. So it is a step-by-step, institutionally required process. And the first thing is, at least for the first case of the day, we all introduce ourselves and state what our roles are. So everyone remembers each other's names.
Right.
Can you think of a case that you're particularly proud of? Is there a surgery that you've done that you're very proud of that really was a signature moment for you?
But there's definitely been a few cases of some adolescents who have congenital or from birth variations of how their reproductive tract formed. And these can cause pain. They can have block problems with either abnormalities of the vagina or of the uterus that require a detailed surgery and someone who knows what they're dealing with. And there have been times where patients have either been mismanaged elsewhere or just no one's been able to figure out what's going on. And the opportunity to see and treat these individuals and fix what needs to be fixed and help them get their life back and help empower this young person to go ahead and have a normal, healthy reproductive life and talk about what this means for future fertility, et cetera. Like, that is such a special and unique experience. There's this one young woman who I saw after several other gynecologic consultations to figure out why she never got her first period. We figured out pretty quickly that she had a very unique gynecologic disorder that was going to require surgery to fix because there was something abnormal about her vagina and menstrual blood couldn't come out. To take care of her required me to assemble a team of surgeons to help fix the problem in an emergent, time-sensitive way. And she's been under my care for probably the past 12 years. So she's actually one of my longest patients since I'm at my current job in New York City. And it's just been so remarkable to watch her grow up and see how she navigates this condition and how it can influence her current reproductive and sexual life, as well as her ability for future reproduction. And she's just dealt with it with such grace and positivity. It's tough to be a young woman growing up who is different than their peers in some ways. This person has an interest in going into the medical field. And one of the things that really was a special moment that we shared is she told me that the essay that she wrote to help her navigate the waters of starting medical school or physician's assistant school or something is that she wrote about our relationship. That's just so special to me, just to think that, in this field where I take care of these young women and I'm the first gynecologist that they really interact with, that you can really have such a marked impact on someone's life.
And with all these hats, you also teach. So talk to us a little bit. I mean, I don't know where you find the time to teach, but talk to us about how that came about. Do you love it? And who are you teaching?
I do two different forms of teaching. And some of the teaching I do is a dedicated PowerPoint lecture or case-based lecture where I'm teaching occasionally medical students, more commonly our residents and fellows, and sometimes other groups or divisions at the hospital ask me to come speak on a certain topic. So that I very much like is a more didactic, but often interactive conversation on a specific topic. The other type of teaching, and this is what I do more of all the time, is patient-facing teaching, where often when I'm in my office seeing 25 to 30 patients, I have often a resident working with me who's seeing my patients alongside me. And sometimes they'll go into a room to take a patient's history, come out and talk to me. We'll talk about the patient. We go back in together. So there's in the moment teaching, which I so enjoy because I think that's, for me, that was one of the ways that I learned best. There's some great, always nuance and clinical pearls and things that just resonate when you've seen it and dealt with it hands-on. So that is the other type of teaching that sort of happens in stride, both in the office as well as, the days that I'm in surgery where I may have residents with me during those days.
And I can see the pride and the joy and the satisfaction that you get from that all the time.
Your kids, they're your
That's right.
kids.
Something else that we do want to explore is something that you have been fighting for a period of time. We recently had a guest on named Sadia Zapp, who works for the Breast Cancer Research Foundation. And it was a very unique conversation for us to have because this is a young woman who happens to work for the company or for the association that exists to fight the disease she is fighting. It was such a moving discussion. Similarly, you have also been struggling with cancer and fighting cancer for quite some time now. And I can't imagine as a physician, as a doctor, knowing what you know and living the life that you do, how somebody can do that and how you manage to push through from a time perspective, an energy perspective, a scenario of knowing too much. Can you talk to us a little bit about your fight and your struggle?
Sure. So it's been hard to believe, almost 9 years since my cancer diagnosis.
Wow, I didn't realize that long. I mean, obviously I knew it was a while, but 9 years?
2016.
Wow.
Yeah, going on 9 years in February 2025.
Wow.
And it knocked me off my feet and was never what I expected as a newlywed. It's been a journey. It's been eye-opening in lots of ways, challenging, had a lot of hairstyles along the way, thanks to chemotherapy.
You were a blonde when I met you.
Once, blonde hair. And it was like a little chemically enhanced, but yeah. I must say, being a physician and going through a cancer diagnosis and some pretty tough courses of treatment, major surgeries, you name it, has been eye-opening to say the least. I mean, I've just had to navigate waters and experience people who I really wish treated me the way I think I treat other people. I've had to advocate for myself. I've had to get multiple second opinions to try to understand what to do. I mean, the cancer I'm dealing with is very rare. so rare that there's not a playing field out there. If this was a more common cancer, there would be a path, and you do A, and then you do B, and then you do C. Well, I passed all those things a long time ago, and I'm doing great, as great as you can do. But my physician jokes that I live in a data-free zone. There is no medical
Yeah.
study that says what we should do next. And I've been a guinea pig, and I've tried lots of innovative things, and I'm fortunate that I've often responded to lots of innovative things that I've tried. But I've also worked fairly full time throughout this.
Amazing.
Whether that makes me crazy or not, it has been the best distraction because I can't sit at home and think about the fact that I have cancer. I would rather be the doctor than the patient. And it's just been grounding for me just to normalize life as best as I can. So that's been part of my mindset. I have a tremendous team around me, and I recognize that as a physician, I probably have been able to advocate for myself in ways that other patients haven't been able to. And I have this amazing team and other opinions that provide input to my care. So I'm really fortunate.
You just touched on it there. The idea of, is it a blessing or a curse that you know so much about the human body as a physician? Do you grapple with that? Is ignorance bliss? Do you wish you knew less a little bit about your condition or about what's happening with your body?
That's a good question. One of the treatments that have been offered to me from day one of my diagnosis was radiation. And I've seen some of the terrible side effects of radiation, how it can harm the
Sure.
intestines and the bladder and the skin. And I was deathly afraid of it. And I never would consider it as an initial treatment because of that. And my team knew that for the longest time, it was something I was never willing to consider. I'd gone through 2 huge surgeries. I've gone through multiple rounds of chemotherapy. But recently, this past March, it came up again as we'd been talking about it for the 6 months prior, like maybe my next best thing. And I wrapped my head around it and finally realized that I was going to take the plunge. And they were able to provide that service in a way that made me comfortable. So that's probably a great example of I knew too much. And I also might not have known the right things. But again, my team couldn't tell me that this was guaranteed to make a difference. Turns out, seems to have provided some benefit, which is great. But I was scared. I didn't know what to expect. So I think that's one of the situations where you know a little too much. And I had to engage my team and multiple opinions to get my head around it. It took a while.
There's a certain amount of service to what you're doing, right? I mean, your whole life has essentially been about service, whether it be service to your community, now obviously service to your patients as a doctor. In this sense, since your cancer is so rare and unknown, do you take a certain amount of solace in the idea that, the treatments that are happening to you, there's service in that because obviously this will teach others who may eventually have the similar type of cancer that you have, that there is a roadmap?
It's a really great point, Tushar. So I recognize that things that have happened to me may benefit others. Interestingly, when I was meeting with my oncologist a few weeks ago, and I said, "What's new?" Because I hadn't asked him that in a while. And he's, "Well, we're looking at new things. In fact, your tumor is part of that study," which is weird to think that they still have like pieces of me that they're studying. One of the coolest experiences that I had, and Larry was part of, is my initial treatment for this cancer was I was part of a clinical trial.
Right.
There was this new drug out there that was specific to my condition that I met the criteria to be part of this trial. So it wasn't available to the public yet, but it was what's called a phase 3 trial. It's already been tested. They know the right dose, and now they're trying to figure out its true effects on a tumor. And the thought was it might be able to shrink this tumor. So is that the side effects seemed to be low. Did I want to give it a try? And my team seemed to say that this was not crazy. I could try it for a few months, get scanned again, and lo and behold, I tried it. I tolerated it really well, and my tumor shrunk. Fast forward maybe a year or two later, as this drug is finally about to come onto market, and I was invited to the company's headquarters in Boston to speak to the
That's
team who had created the drug and was working on the drug.
to tell them my story, because I was kind of patient number one. I was one of the first patients to use this as an initial treatment for my cancer. I get emotional just thinking about it. I mean, it was such an emotional day just to meet the researchers who had thought about this drug, created this drug, done the trials on this drug, and speak to them and share with them why their work was so important, because they needed to see what they were doing was making such a big difference.
And having been there with you, there literally wasn't a dry eye in the room.
Okay.
Not one dry eye.
I talked about my life growing up and wanting to be a physician. The one joke I didn't tell you guys is everyone always asked me, like, why I didn't go into dentistry? And I was like, well, I didn't like the fact that my dad worked in a deep, dark hole. And I said, but then I became a gynecologist.
But cue rib shot.
Yeah. So, I told them that story, and I was just like sharing my story and how what they did had been hopefully life-saving for me. And in fact, I had my surgery and I ended up going back on the drug for another 2 years or so. And subsequently, Larry and I went out to the company that was actually producing the pills and met that team. And that was really, really cool. And at that point, as I shared with that company where my life and where I'd been and how they'd been so instrumental in treating my cancer, we also shared with them that we were pregnant, which is really cool. At the time, we were 18 weeks pregnant. I couldn't carry just based on all that I'd been through. And so we had a surrogate. And again, it was just, I think, really inspiring for those people to see the good in what they did. So I don't think a typical patient would have had these experiences. I think being a physician and the doctors who have been part of my care since day one were the ones running the clinical trials. I mean, they got me access to these 2 engagements, but those were really, really cool experiences.
I will simply say that Wonder Woman ain't got nothing on you. You are the real Wonder Woman out there. My God, it's ridiculous.
Yeah.
Yeah. And Sam, you need to kiss this woman's feet every day. She should have done better. She can do better. Beth, what's it like to be, I guess now, 6, 7 years running now? One of the top doctors in New York in your field? The country,
Yes.
pardon me. Considering what you are going through as well to maintain that level of excellence.
I don't have a tissue. I have a mask.
Perfect.
Get that out of my bag.
For those listening on radio or on audio, my Beth is wiping her eyes with a surgical mask right now.
Improvisation at its best.
What was your question?
What's it like to be awesome?
Well, okay, so I was going to say, it all depends on how much stake you put in those surveys. I mean, some of those surveys do have some merit because it's doctors nominating other doctors. I get some of these I think are not exactly as meritorious, as impressive, some of these accolades. But it is cool that I've been recipient of some of these awards, and I'm far from the only one of my colleagues who has been.
Your journey is remarkable. I do want to inform you, though, that the way you feel about the people who helped you, I'm sure your patients feel about you. So that's a fact. While you're going through this career journey, your struggle with cancer, etc., I mean, do you take time to consider your legacy and how much you're helping people and the impact that you're making in the world? I mean, it's remarkable.
I definitely hear it from some patients. I hear it from some of my adolescent patients who, as they're moving on to an adult provider, there are hugs and we reminisce about how long I've known them. I hear it from my patients from my fertility practice who I've helped get pregnant and helped them build their family in a special way. One of the coolest things that has happened a few times is I've had some students either writing essays for college or for medical school about the impact that our relationship has had on them. That's something I'm so proud of. When I step back from the grind of, oh my God, I'm 20 notes in the hole and I don't know when I'm going to get these done. So when I step back from the grind of long days and catching up and all the nitty gritty, like the not so glamorous parts of being a physician, I have the best job in the world. And it's really what drives me. It makes the work worth it. I've always been proud of the care I provide and the job that I have. And I'm very honored to interact with people at such an important time in their lives and to make an impact. That's how I want to be remembered.
For anyone else out there who wants to have the best job in the world like you, what is that piece of advice you want to give? Is there one piece of advice or multiple pieces of advices you want to give to someone who wants to have the best job in the world, Beth?
I will say, like, one of my friends has always said that I'm the happiest doctor he knows. And that is me. There's highs and lows of being a physician for sure.
That's a very ancient saying. Be happy in your work.
My pointers for others are, you're going to have to work hard for this career, but to avoid tunnel vision and avoid pigeonholing yourself and allow yourself to experience other things and allow yourself to have more than one passion in life, because I think it enhances your life and the career person that you're going to become. I think mentorship is key because that has clearly been critical for me every step along the way. And I think it's important to understand the good, the bad, the ugly of what you're getting into, because every part of medicine has the highs, the lows, and you have to be able to tolerate the best of days and the worst of days. And I think working through that thought process is really important.
Well, I see you doing that day in and day out. And for me, looking at your journey and living part of your journey with you, the admiration for me could not be greater. And I do want to bring up that it's always a great satisfaction for me when I see the parents in particular of your patients, and I see the way that they look at you, and I can see that the difference that you're making in their families' lives. And it's truly one of the most remarkable things that I've ever seen. So, with that, Beth, I think this is a good place to say thank you for coming with us today on this journey and sharing all of this with us and really being so open and honest and telling your story.
Thank you for having me. It's been a great experience. I admire so much what you guys do on this podcast, and I'm just honored to be part of it.
So that was Dr. Beth Rackow, obviously a story that I'm quite familiar with. So guys, why don't you give me your thoughts? Tushar, please lead us in.
Sam, I've said it before about your wife, and I'll say it again. She's an absolute superhero. Beth's the path to become one of the best doctors in her field is unconventional, right? She was pulled off the wait list for going to medical school. She was rejected from a lot of medical schools, and she didn't let that get her down. She had a singular focus because in many ways it was because of her upbringing, right? She wanted to go into the family business of being a healthcare giver. Her father being a doctor, being a dentist. She's just amazing when you hear her story. It's unconventional in the fact that, she did take time off to work in the Forest Service. She would have been successful at whatever she did. She could have gone into law, as she had mentioned. I mean, obviously she would have been successful in whatever job, whatever career she chose, because she's so driven and focused. But I'd say at the end of the day, it's not so much that, but, it's her ability to overcome and her singular focus, which has allowed that. It got very heavy and very intense when we started talking about cancer. This is obviously a subject that we have known for years. We don't talk about it a great deal. For her to have gone what she is going through, I mean, she's not done with it yet. What she's going through, and to have come out on the other side stronger. It's just amazing. I mean, she's such a wonderful wife, a wonderful woman, wonderful mother. I am in awe of her at all times. I mean, you hit the jackpot, Sam. That part is for sure. And I'll say it again. She is an absolute superhero. What do you think, Shay?
I love that you use the word superhero because I literally wrote that in my notes. I think most doctors are superheroes, but then you hear Beth's story and it just takes it to a whole nother level. I mean, really impressive.
Wonder Woman's got nothing on her.
Super impressive. I was also taken with the role that athletics played in her life early on. She said she loves to be on a team. She's competitive. She's driven, and this really kind of set her up for her career journey and a life of winning, basically, So super impressive the way that played such a vital part of her life, and we did talk about this as well, T. I'm squeamish, so This is not a job for everybody, but I couldn't imagine the level of joy that she must get changing people's lives every single day, the amount of dedication and service, and she wants to help people, and it's just so admirable, and we can't thank her enough for sharing her story because it's a remarkable one.
Larry, you used the perfect word to sum up what Beth does. And that word was joy. Beth is a person who tackles each day with such desire. I don't know if ambition is the right word, passion, and just this incredible attitude that makes the work that she does feel like something beyond work. People have jobs and careers, et cetera, but what Beth does is something completely different. This is a person who puts in 12-hour days without even blinking, and it doesn't feel like work to her. This is passion, a calling, and beyond. So what I see her do day in and day out is just truly remarkable. And then in terms of her health stuff, she's been fighting cancer for close to 10 years. And she has shown and demonstrated a strength that I didn't really know existed within people. I mean, she's been through surgery and chemo and all these other things, and she's never allowed it to get her down. She's gone to chemo on Friday, and she's gone back to work on Monday, and I ask how she is, and the response is, I'm fine, I'm good, and she just keeps going. It's truly, truly incredible. So, for any young doctor out there, hopefully this conversation has shown you a little bit in terms of what it takes to get to that next level, and you can pull some great advice and some great nuggets out of this. And beyond that, just from a human interest aspect, or just from a human standpoint, Beth should be truly an inspiration to anyone out there who has a battle in front of them that they need to get through. Well, know that you can do it. And a lot of it depends upon your attitude and your perseverance and your perspective on things. And what Beth has shown me day in and day out over this past, however many years has truly blown my mind. So, with that, Beth, I've been asking you for a long time to break down and join the show. You finally did it today. I thank you so much for agreeing to come on with us. Your story is certainly remarkable. We also thank you for joining us. If this episode made you think of someone who could be a great guest, please send us a note through the contact page of our website at NoWrongChoices.com. While you're there, please check out our blog for a deeper look into each of our guests and episodes. As mentioned at the start, don't forget to like and follow us on your favorite podcast platform and to connect with us on social media. You can find us on LinkedIn, Instagram, Facebook, YouTube, TikTok, and X. Your support helps us to keep bringing these incredible stories to life. On behalf of Larry Shea, Tushar Saxena, and me, Larry Samuels, thank you again for joining us. We'll be back next week with another inspiring episode of No Wrong Choices.